Okay, hello again, everybody, and welcome to the Maine Health Management Coalition's webinar today. My name is Marie Stuckey. I am the Member Relations Specialist here. And I just want to start off by thanking our presenters today for their time and participation, and I will introduce them in just a moment. But first, we'd just like to give you a brief explanation of how we run our webinars. I'm going to start with a little bit of an overview about the coalition for anybody on the phone who is a non-member, and then let you know about some upcoming events. You should also know that our presentation today will be available on our website should you want to access it later. And there will be a webinar survey sent to you afterwards, and we would love to hear back from you so that we can best serve you for future webinars, and feel free to suggest any topics of interest. At any time during the webinar, feel free to type questions in the chat box at the bottom of your screen, and we'll save those for the end of the presentation and ask our presenters to address them at that time. So a little bit about the Maine Health Management Coalition. It is a purchaser-led partnership among multiple stakeholders working collaboratively to improve health and to maximize the value of healthcare services for the employees and dependents of Maine Health Management members and all the residents of Maine. Our vision is to have the state of Maine lead the country in population health status, patient care experience, and low per capita healthcare expenditures for a favorable business climate and economic growth and job development. Our multi-stakeholders are comprised of consumers, purchasers, health plans, brokers, benefit consultants, providers, and affiliates, and we currently have over 70 members. We achieve our mission through a variety of ways, but our data department is the foundation of everything that we do. We have an all-payer statewide claims database to help you understand your healthcare spend. And we also achieve our mission through transparency and public reporting on our consumer website, Get Better Maine, where providers publicly report on their outcome, safety, and patient experience and cost ratings. So I encourage you to direct your employees to check out Get Better Maine so that they can find the best quality providers to help them improve health and productivity. We also achieve our mission through consumer engagement with programs such as CEO Champions and a wellness trust that we're developing in our value-based insurance design model, which you will see under the benefit design portion. That's where we are working with patient and providers to develop a plan that is coordinated for appropriate high-quality, patient-centered care for the best cost and quality. And you can access a webinar that we previously had on value-based insurance design on our website if you'd like to, and you can contact me for information on that. But the basis of the plan is that it rewards payers, patients, and providers for outcomes using evidence-based care instead of fee-for-service models. And I encourage you to find out about joining a VVID work group, too, so you can actually influence the development of this plan, which is set to launch in early 2016. Finally, we also work on payment reform here, exploring alternative payment arrangements with providers, hospitals, and systems that align with our goals. Please mark your calendars for the 17th and 24th of June. We have two webinars scheduled. The first one is a shared decision-making webinar covering shared decision-making in primary care. And then the where we'll have lots of people join together for an educational and networking event down in Portland, and we hope you can join us there. Other opportunities to learn and get involved would be some of our work groups, reading our newsletters, some value-based insurance design training, and we also offer some evidence-based medical policy training for policymakers. Here's a slide just showing our members, but you can also access this on our website under Join Today. And if you have some questions about membership, feel free to contact me at any time. My phone number and email are on the bottom of the screen. And that's just a slide of some of our members. So I'm going to begin now by presenting our presenters for today. Chuck Hayes is kind enough to join us today, and he is the CEO of Maine General Health and President and CEO of Maine General Medical Center. He joined the state's third largest healthcare system in 1995 as Director of Engineering. Chuck graduated from the Massachusetts Maritime Academy in 1986 and began his career with General Dynamics in Groton, Connecticut, where he was supervisor of nuclear testing for the 688 class fast attack submarines. He then moved to Framingham, Mass., where he worked at a firm which provides operational and regulatory consulting for major utilities throughout the U.S. In the 18 years since Mid-Maine Health System joined Kennebec Valley Health System to become Maine General Health, Chuck has held a number of positions of increasing responsibility. As Senior Vice President and Chief Operating Officer, Chuck headed the team responsible for the construction and operation of the Harold Alphons Center for Cancer Care, which opened in July 2007. In October 2007, he was named President and CEO of Maine General Medical Center, and in January 2012, he became CEO of the parent company, Maine General Health. In addition to receiving his bachelor's degree in engineering, Chuck has earned a master's degree in business, which he began at Bentley College while living in Massachusetts and completed at Thomas College in Waterville. Chuck is and has been a member of many organizations and has served on numerous boards. So we thank you, Chuck. And now I'm going to introduce our second presenter, Denise Dumont-Bernier. She is the Director, Workplace Health and Maine General Medical Center, responsible for the operations of multiple freestanding occupational medicine practices in Kennebec County and numerous on-site occupational health and wellness contracted services. She was also responsible for developing Maine General's Express Care services. She holds a baccalaureate degree in physical therapy from Simmons College, Boston. She has over 25 years of experience with providing on-site occupational health and rehabilitation services and with integrating worksite wellness services for many employers throughout Maine. Denise joined Maine General almost 9 years ago, has been a member of the Maine Employers Mutual Insurance Company Medical Advisory Board for over 15 years and is the chairperson for the Healthy People of Kennebec Valley, a business-driven worksite wellness council. She's presented at numerous regional and national conferences on a variety of topics. Denise has always been passionate about injury prevention and the health and safety of Maine workers. Throughout her current employment with Maine General, she's able to offer businesses an integrated solution to healthcare in the region. She believes that employers have a critical role and the power to influence healthcare consumerism through their employees and their families. In partnership, a healthier community can be built, and healthy and productive employees mean healthier Maine businesses. So I now introduce you to Denise Dumont-Bernier and Chuck Hayes.
Well, thank you for that introduction. I just start by just giving a little bit of a background of Maine General Health. We're the largest employer in the greater Kennebec Valley region. We employ about 4,000 people. We have services, both home health and hospice, long-term care, retirement community, hospital, and physician practices. Our workplace health, which Denise runs, a division of the medical center, leads a team of over 40 people who partner with Maine businesses to provide employee health examinations and screenings, workers' comp, injury management, health and productivity enhancement services, and we've been doing this since 1988. And we do it from really two freestanding facilities in Waterville and Augusta, but also do a lot at the work site. So I did want to start by thanking the Maine Health Management Coalition for asking us to share our experience today. We have been part of many webinars and have done plenty of presentations, but this is really the first time that we've been a presenter on a webinar. So you never know, I might be tweeting next week. I'm feeling technologically savvy. But we hope that what you'll take away today is really ideas to enhance your own wellness as well as your bottom line. So at Maine General,
okay, that's on to advance.
See, we're just trying to move the slides here.
Chuck, just try clicking on your presentation.
There we go. That worked. Thank you. So, at Maine General, our mission is to enhance every day the health of the people in the greater Kennebec Valley. And certainly in healthcare, we have an organization full of people who want to help others, but often fail to take care of themselves. And although we focus on health, the health of our community, our healthcare workers are not always making good personal health choices. In fact, when it comes to healthcare spending, healthcare workers spend more than most, or above the national average, and that's obviously due to a multitude of factors, but it includes access to services and really the expectation on utilization once they seek out healthcare services. So back in 2005, we realized we need to curb our increasing costs of our health plan spending. We have a self-funded plan, so it was really negatively impacting our bottom line. And we began implementing what I would call basic wellness efforts. So we'll talk more about the evolution of all these efforts as the presentation goes on. But it's really been a journey, and we've learned a lot of lessons. Celebrated a lot of successes. We've also made a lot of adjustments along the way to really help keep pace with the changes both in our organization but also in wellness, and really to breathe new life into the program to continue to make progress. So today, during our brief time, we'd like to touch on these objectives that you see on the screen. We want to review why current healthcare trends, things like rising obesity rates, chronic disease, sedentary lifestyle, are really not sustainable and, quite frankly, costing all of us a lot of money and impact to our bottom line. We know that we have an aging workforce, and we need to pay attention to the health needs and the productivity impacts of that aging workforce. We hope that you'll learn why employee health should be applied to your overall business strategy. It's really an investment that pays significant dividends in the end, and we'll talk about that a little later. And then certainly learn from our successes, and we want to share what's worked for us, and then recommend really the key elements of those success. So most of us are experiencing significant insurance premium increases, often in the double digits. And many employers are dealing with those ballooning expenses by shifting the cost burden to employees by really increasing deductibles, co-pays, co-insurances. With the Affordable Care Act, we now know that insurance plans are required to cover preventative care services such as mammography and colonoscopies. But the rising cost is really around the sick care. We have a culture that is largely sedentary and inactive. And we all know we have busy lives. We often take on too much, overscheduled. We're not focused on our own health care in the process. And that relates even back to our families. We know that over 51% of our kids in kindergarten are considered either overweight or obese. Many of us don't take the time to plan healthy meals. We zip through the fast food drive-thrus, in between meetings or events. We're eating too much processed food, and it's really impacting our health. All of this, in addition to the sedentary lifestyle, is really contributing to higher diabetes rates and other chronic conditions such as heart disease. And how many of us are actually getting 8 hours of sleep per night? We know a good night's sleep is essential to good health, recuperation, and rejuvenation. So all of these trends are contributing to our poor health and rising healthcare costs we're all facing. But if we take a different example and you look back to the late 80s and early 90s here in Maine, some of you may recall how the governor appointed a Blue Ribbon Commission really to address the workers' compensation crisis we were having in Maine. Our injury rate and costs were really going through the roof, and workers' comp insurance companies were refusing to underwrite insurance in Maine. So Maine responded by changing our laws, but more importantly, employers responded by focusing on workplace safety, ergonomic programs that prevented and really reduced injuries. And they also focused on the return to work programs, which kept injured workers in the workplace, really accommodating their injuries and preventing that disability mindset, really engaging the employees at work. All of this work significantly reduced the cost associated with the indemnity payments being made to workers and that were out of work, and the lost productivity within the business. So as you can see in this graph, we've been able to change the trend of occupational injuries and illness over the past decade substantially, really in every sector. So we've done this before. Today we're facing the same type of challenge around healthcare spending. People really need to take more responsibility for their personal health and lifestyle choices, but it's not easy. We all know how hard it is to quit smoking or lose weight. There are many, many resources out in the community, but sometimes accessing those are difficult. People don't know what's available to them. And then we all know behavior change is hard. Making personal lifestyle changes to be healthy is not easy. It's hard work. And we've learned at Maine General that really providing a personalized approach, which really meets the individual where they are, has been the foundation for our success. But employees have the opportunity to support healthy behaviors, really change the workplace through, both the workplace but also their health plans. We spend a lot of time at work with coworkers in an environment that really can be conducive to good health or destructive to it. When you think about lunchrooms, vending machines, we used to have pizza parties that celebrated everything, or cookies, back-to-back meetings, really no opportunity, to move or really providing, quite frankly, food that was unhealthy to our staff. And is this really an environment that supports somebody with, say, diabetes who is trying to lose weight?
The other issue that I think we're all facing too is that we have an aging workforce, especially here in Maine. We know people have not prepared for their retirement financially as well as they could have or should have, and so that's forcing people to keep working later into their lives. People want to keep working because of just stimulation. I have a medical director in my practice who has been talking about retirement for the last, I swear, 4 to 5, 6 years or so, and he's still working. And part of that is because he loves his work. He loves the people that he works with. He loves the work that he does. And he feels challenged and stimulated every day. And so the thought of retirement and really having a major change in his lifestyle it's hard to think about. And what life after retirement might be like for him is a little scary. Medical benefits. We've come to find out that Medicare, after we turn 65, may not cover the majority of medical expenses that an older population is incurring, and people really need to start thinking about carrying supplemental medical benefits even as they age. And in Maine, the percent of the population over age 65 is growing at a faster pace here in Maine than in the rest of the country. I'm not sure we realize that. And in central Maine, that's where the oldest population tends to reside here. So we, as the employer community, are facing older workers working longer, staying in the workforce. And so what does that mean from a wellness standpoint, productivity standpoint? As we age, we typically see higher incidence of chronic diseases such as high blood pressure, heart disease, diabetes, cancer, arthritis, depression, and so forth. And as you can see when you look at this graph here, when you look in the above 45 age group, you know, in that 45 to 64 age, 67% or 2/3 of us have at least one chronic condition. And 40% of us have 2 or more chronic conditions. And you can see once we hit 65 years of age, almost 9 out of 10 of us will have at least one chronic condition, and 2/3 will have 2 or more. Now that's pretty substantial. And so these are our employees and our workers that are still in our workplaces, and we typically will get sicker as we age, and that's just what happens when we're not paying attention to our personal health. So if you think about the average age of your own workforce, and if that is creeping up over 40, it's really something that employers need to start paying attention to. Here at Maine General, the average age of our workforce is about in the mid-40s as well. So it's something that we're focused on. In this slide, you can start to relate the number of chronic conditions to age and lost time and lost productivity. So if you look at the relationship of chronic conditions to lost time, according to the National Health Interview Survey, the more conditions a person has, the more work days are lost per year on average. And as you can see here, again, as we hit 40, healthy people lose only 2.3 days per year on average. But people who have one chronic condition, that increases to almost 5 lost days per year. And with more than one chronic condition, over 10 days per year are lost. So as an employer, and we're thinking about productivity and health of our employees, this is substantial as we have an aging workforce, so we're looking at that. As we look at the full cost of poor employee health, the direct medical care and pharmacy care costs, those medical costs, are really only the tip of the iceberg and represent only 25% of the total cost. As you look at everything below the surface, the intangible, sometimes intangible or less indirect costs are really around absence, which is people are not at work, so they're not productive. It contributes to our short-term and long-term disability costs and so forth. But the other thing to consider, too, is that we have this thing called presenteeism, which means that employees are at work, so they're not absent, but they're at work, but they're not focused on their work. They're not as productive as they could be, and that could be because of stress or health-related issues and so on and so forth. And that 75% of the productivity cost is something that we should be paying attention to. So we want to move into talking about applying an employee well-being to your business strategy. We work at Workplace Health, the Occupational Medicine Department of Maine General. We work with many human resources managers on their occupational health and their workers' comp strategies. And often they're being delegated the responsibility of developing a wellness program for their organizations. And human resource people, we know, often wear many hats. They're responsible for hiring, performance management, discipline, benefit plan oversight, retention strategies, among many other things. And oftentimes they're the folks that we find understand the importance of investing in human capital, the importance of having a robust wellness program and an engaged workforce. But that's a lot to take on. Developing a wellness program is not an easy task. especially for a smaller employer with maybe one human resources representative. Today, we encourage our business partners to make employee well-being part of the overall business strategy. And so not to think about it as a program that resides in human resources or as part of the benefit package, but really employee health and well-being really should be part of the overall business strategy. And when this is done successfully, there are many advantages that the organization then benefits from. And I'm going to let Chuck talk about how that has benefited us at Maine General. Oh, I've got one more, sorry. So employee well-being. If you take care of your employees, they'll take care of your business. It's really been our mantra. And you got to make it part of your business strategy. And when you talk about wellness programs, a lot of times we're focused on if we improve the health of our population, how will that reduce our health care spending or our claim spending? And that's an important part of the big picture, but I think there's other parts that we need to consider. One is around engagement, and there's a lot of talk about employee engagement, how critical that is. And engagement really means, do they like their job? Are they engaged in their work? Are they doing good work for our organizations? Are they being productive? And when you think about it, having a wellness program with a lot of fun activities that engage people in their personal health really helps to enhance the whole overall business engagement strategy of an organization. The other piece that I think is really critical too is making health and employee well-being part of the culture. And the culture really comes from the leadership of the organization, the work environment of the organization, and many other factors. But it's really critical to make sure that we're focused on all these areas. And now I'll let Chuck talk about how we've been able to manage and link those to our priorities here at Maine General.
So what you're seeing on the screen now are really some of the ways that your corporate priorities can be linked to your employees' health. And all these, as you'll see, are really critical to the business success. But just as important as you approach these corporate priorities is really setting goals and measuring the outcomes. So I'd like to share some of the learnings and some of the successes we've enjoyed at Maine General over the years. As a healthcare organization, you would think this was easy, but it hasn't always been easy. It's really been an evolution over many years, trying things, some that worked, some that didn't, refining them, realigning the goals and the strategies to adjust to really both the changing needs and our changing environment. So health systems like Maine General have been through many of these challenges over the past decade. I mean, we've merged, consolidated, grown, and in our case, a year and a half ago, we moved into a new hospital, which was an opportunity that we took advantage of to really change a lot of our infrastructure to support the culture of wellness.
If you look at the evolution of the wellness efforts here at Maine General, I'll take you through this. And like Chuck said, this has been a lot of trial and error, but we've learned and have done some really nice things that are worth talking about. We started our wellness program back in 2002, and at that point, it resided in our Human Resources Department. They hired a nurse who was doing health risk appraisals with employees, and we rewarded employees with a gift card for coming in and actually getting that done. We also went smoke-free at that point. And then in 2004, we started to offer reimbursements for local gyms. We wanted people to get physically active, and we paid for access to and worked in partnership with many gyms in our region. We continued to promote the health risk assessments, and we started branding our program. And at that time, it was called Life Engaged. In 2006, we moved the wellness services out of the Human Resources Department, and we moved it into the Workplace Health, the Occupational Medicine Department here at Maine General. And that in itself, I think, boosted participation. I think its natural tendency is that employees don't want their employers to know about their personal lifestyles and health risk, and certainly not their Human Resources Department. So, and privacy is always something that employees are concerned about. And so when it was moved out of the Human Resources Department, and I still look at Human Resources is my customer, and I work in partnership with our Human Resources and our benefits folks to really make sure that we're moving our program in the right direction. But we saw a nice boost in our employee participation rate in our wellness program when it was moved out of the department. We also started using a different software system, the Wellness Works tracking system, which really allowed us to start to demonstrate and quantify our outcomes and the cost benefit of what we were doing. We moved from just doing health risk assessments to actually hiring health coaches and doing more coaching and working one-on-one with our employees on their personal health plans. In 2008, after using the new software for a couple of years, we were able to demonstrate outcomes and the financial impact of what we thought we were no longer spending because we were seeing our employees get healthier. We also instituted an e-newsletter that goes to all employees on a monthly basis and did a lot more in terms of education, communication, and programming and challenges that really got to get people more engaged. We rebranded our wellness program to become a healthier you. In 2013, more recently, we started to focus more on culture. We had just moved into our new hospital, which is on a gorgeous plot of land with walking paths, a new environment, healthy cafeteria, and so forth. So we capitalized on really a focus on the culture here at the organization. We also instituted the Healthy Living Resource Center, which is a community-based program. We organized stakeholders within our organization, which are really anyone in this organization who had a role with improving the health of our employees, and brought them together in terms of building better strategy and focus, and that has been really, really effective. We also identified and trained champions in every physical location and department within Maine General, and we have well over 100 champions that are basically promoting wellness programs and well-being and educating people in their own work areas. Most recently, in 2015, March of this year, we partnered with Virgin Pulse, and so we finally are enhancing the program with technology. So Virgin Pulse has a web-based application as well as a phone app. So those of us who like to track things, it has a social media component so we can form teams, we can challenge each other, and what we're finding is it really has further boosted our engagement of the wellness program at Maine General. Here's a slide of what happened, our claims cost per employee per year. And you can see back in 2006, 2007, that's where we were identifying that we were spending more in our healthcare claims than was expected. And that's when we knew we had a problem. We needed to do something to address it. And so that's where we really made the focus on the wellness program, including personalized health coaching for our employees. We hired more people. We increased participation. And then you can see in 2008, and then since then, we really have flattened the curve of our health plan spending. Maine General is self-funded for its health insurance and our health plan, and this was remarkable. So for many years, you can see that our health care spending was way below the expected trends. And during those 4 to 5 years or so, we didn't increase our premium cost to our employees because we were holding our costs down. Our wellness software that we use help us to quantify what we think contributed to that. And so in this graph, if you look at, this represents about 1,500 people, and this is back a few years ago, but the blue bars are what their health risk score was when they started in their wellness program and on their health risk assessment. And then over several years, looking at that same cohort of people, you can see that their health risk scores improved over time. So you can see the low-risk red bar going substantially up, while our high-risk number of folks were going down. At the same time, in 2008 through the present, we actually look at and work with our TPA on what are our low-risk people costing us from a health plan standpoint, what are our medium risk, what are our high-risk people costing, and started to look at those numbers, and clearly we could see that our low-risk people were costing us much less than our medium or high-risk folks. And the same held true year after year. We also started looking at the employees who chose not to be in our wellness program, but who were on our health plan and what they may be costing, what the spouse population is costing, and we didn't have a lot of engagement at all with spouses, so that was a real big challenge. But when you start looking at the differences between what a low-risk person costs, so back in 2008, a low-risk person was costing us on average about $4,000, and our high-risk costs were almost $10,000. So it was pretty substantial. We can continue to look at that and started to look at our non-participating employees who are costing us on average over $5,000. They're about the same as a medium risk bucket, and our spouse population were costing us as much as our high-risk people. So this was good information for us to look at and track. And the way we tried to quantify things, and this is based on 2012 average claim costs, but if you looked at the difference between a low-risk person and a medium-risk person, and you look at the change, we had several hundred people that changed their risk scores from medium to low or from high to medium. And if you look at those numbers and you look at the variance between what a low-risk person was costing us and a medium and a high-risk person, the difference between a high-risk and a medium person was $5,000. So simply by doing the math and saying, if we have 143 people that lowered their risk score from high to medium, and that variance is about $5,000 per person, we think that we didn't spend, $730,000 of healthcare spending. And if you add that all together, it was close to $1 million. So that gets the attention of the CEO and the CFO of any organization. And that really just allowed us to reinvest what we think we're not spending in terms of holding our healthcare costs down. So it's a really good success story, and we continue to work hard on this.
So let's talk a little bit about the impact. We had 3 years with no benefit cost increases to our employees. We saved millions of dollars for the organization, which really helped our bottom line. We had really a more engaged workforce, and we actually measure that with a survey against other healthcare systems, and for 2 years, we're in the top 20 in the nation. They won't tell you if you're 1 or 20, but we know we're in the top 20 in the nation for employee engagement. And then our workers' compensation rates were low, and we'll go to the next slide. You can see the trending graph for our workers' comp, and you'll see the last year, 7/1/2015, that's an actuarial estimation of where we're going to end up. That's our year, and so we will end up with a couple months to go here in the year. And you can really see the big spike in Maine General Community Care. For us, that's our home health care nurses, and we all experienced the winter this year, and they're out on the roads constantly and walking to houses, so we've had a little bit of a challenge there, but you can still see even with that, our overall mod rate of 0.47 is excellent. So let's talk a little bit about our key steps to a successful wellness program. We're fortunate to have a team that really stays in tune with the latest and greatest on wellness. A lot of seminars, a lot of interacting with other folks to get new ideas and breathe new light. But I think one of the biggest issues is really involving leadership, and we all need to be visible on these programs. I think it really moves the rest of the organization. Communication is a big piece. We put I do a weekly report via email to everyone in the organization, and we include a health tip. We evaluate our health at the senior management team level. We get our leadership group together. We review it. We make it part of our culture. It's not okay to smoke. We encourage healthy eating, and we've committed resources to it. Here you're looking at a program that we started a couple of years ago, where we actually split the organization into 2 teams, and we had various activities for those teams. Everybody was on a team, and we challenged each other with steps, healthy eating. There was a variety of different events we had that went on for quite a while, and at the end we tallied up all the scores, and the winner of the program, which unfortunately was not my team, we donated to their charity of choice. So it's just ideas like that I think are critical. And Denise showed you some of the savings, at least in one particular year. We invest about $500,000 a year in the wellness of our staff, and it's certainly, you see the financial implications on the health cost side, but it's even bigger than that, as Denise talked about, with presenteeism and engagement of the workforce. So, a lot of it's about behavioral economics, and when given a choice, a third of us will use the information and make the right decision, but the other 2/3 will either follow their leaders or take the easy way out and do the simplest thing. So the second item of success is to make things easy for your employees. Here's a picture of our cafeteria. When you walk in, the first thing you see is the salad bar. We've removed all of the deep friolators, or whatever they're called, from the cafeteria. We've switched to healthy vending machines, and it's a process over time. I think one of the most impactful things we did was move to health coaching, and for us, there's nothing like being accountable to having to meet with a health coach after setting goals and coming back and telling them whether you met the goals or not. And it's really hard to be accountable to a computer, which makes the face-to-face meetings all that more important.
You're talking from personal experience.
Personal experience, yeah. So, I did talk about the culture, and really that drives a lot of it, because we certainly need to, practice what we preach. But we've got to create a culture where people want to be healthy and use the available resources. So it's really something that we focus in everything we do. What you see here is some of the things we've done around culture, and as Denise had talked, when in the last 2 buildings that we did, we created walking paths. In the Alpine Center for Health, we have a teaching kitchen to teach how to cook healthy. And all of this, although we were fortunate to be able to redesign our facility, a lot of small businesses, they have teams that walk during lunch and really encourage each other to get some physical exercise or eat healthy. I've known some that have even had small gardens on their site to really improve the healthy eating. There are many community resources out there. These are only a couple, but it's really working with your staff so that they know what those resources are and they can get the support that they need. And then, as I talked about, focus on employee engagement and really, recognizing staff for their commitment and focusing on those and really getting the good stories out through the organization. And it trickles down both to their families and their friends. So it's really important to engage.
And then one of the things that I think we are very proud about is our reward system for employees who are engaged in our wellness programs. At Maine General, we've used nothing but carrots to get people to voluntarily participate in our wellness programs. We've not gotten to the point that we tie wellness participation or outcomes to our benefit plan expense. We don't penalize people who are smokers or anything like that. And I say this because I think it's important that we've had a lot of tremendous success with our program, and it's always been a voluntary, highly encouraged, and somewhat rewarded with gift cards and other benefits. But it doesn't take a whole lot. And I think when you get to the point that you're building a culture around health, which is I think where we have come, is that being healthy is the right thing to do, and it's less about the reward, it's less about the financial gift card that they get in the end of the day, but it's really about how can I, work with my coworkers on a daily basis and take care of each other, take care of our health, have fun doing it, and think about, what does it take to really be healthy, because being healthy contributes to the success of the whole organization. And we've done a lot of work to communicate that back to our employees, is that, we haven't had rises in our healthcare spending. Despite having more employees here at Maine General over the years, our health plan costs have stayed flat. And that is a benefit to all of us. That allows us to perform better as an organization. It allows us to give financial wage increases to our employees. It allows us to keep our health plan costs down to our employees. And that's really the good business strategy that comes out of it. So just to wrap up here, it's really, what does an employee health management look like? And for us, it's really centered around the employee and their family. And then we support those employees with benefits and wellness programs, the work environment, the policies that we have in place to promote health, the organizational culture, and then surrounding and using the community resources that may be available. And so if I just show you for a second what that might look like. Here's Heather. Heather's a registered nurse at Maine General. She's been an employee here for more than 15 years. And if you're an employee at Maine General, she and her family are all on our benefit plan, and she has the ability to be involved with our wellness program and all the offerings that we have. So she has access to robust benefits, which cover prevention 100%. The wellness rewards programs that we have in place. She has access to personal health coaching with a health coach, smoking cessation support if she needs it, and wellness challenges, especially now through our Virgin Pulse partnership, and our EAP program. Her work environment is that of one that promotes health. Heather works at the new hospital here, the Alphon Center for Health, and here we have walking trails on campus. Employee parking is quite a walk away, so you actually get your steps in when you come into work every day. We have healthy cafeteria options and healthy vending options within the building for her. It's a tobacco-free campus. We don't allow smoking, and that includes third-hand smoke. We have a spiritual center that she can go to and meditate and relax and get away from the floor if she needs to. And we have Use the Stair campaigns throughout the building that advocates to use the stairs rather than the elevators. The healthy culture here that she's also supported by is really around senior leadership support. Our senior management team are engaged. They are supportive, not only financially, but they're visibly active in our wellness programs. They talk about it at the senior level. They talk about it with our management team. Health is part of our strategic plan. We're a health organization, so that's one thing, but employee health is really part of our strategic plan. and health is part of the organizational vision and mission. We have a wellness department of champions, and her manager actually supports wellness in the department as well. And this has not come with ease. It's hard. We've always had top-level support. We have employees who are engaged in participating in the wellness program, and sometimes the most difficult part is that middle management, who are very busy and have a lot on their plate, and we're continuously asking them to think about the health of their staff and their workforce. And this is all surrounded by the community resources that we have. Here at Maine General, we have a prevention center that offers a lot of services, the Healthy Living Resource Center, gym memberships, and so much more. Here in the Greater Kennebec Valley, the Workplace Health Department has done a lot of work with different companies in our region to help and support them and develop their wellness programs. And I can say that with the foundation of strong leadership support, but also putting a health coach in the workplace to work with employees to help create personal wellness plans and keep them engaged and hold them accountable, every one of these companies has experienced some benefit from having a wellness program in place. And it changes from company to company, and the challenges are different in every company, but they're all doing something that's really been worthwhile. So we want to encourage others to do that as well. And that wraps it up for us. Just final thoughts are, we're all aging, and unfortunately, as we age, the incidence of chronic disease is there. But we don't need to be unhealthy as we age. And so if we eat well, we take care of ourselves, we sleep well, and employers in our area can really do a lot to support the well-being of their workforces. So with that, I can turn it over to Marie for any questions.
Thank you very much, Chuck and Denise. That was great. Very much appreciated. We do have a few questions. The first one is, how can I get my senior leadership on board to not only support but demonstrate the leadership needed for a successful employee health and productivity management wellness program?
Yeah, and I think from our perspective, we started small and saw some results, which made us want to invest even more in wellness. So I think it's obviously hard when you've got a senior management team that has a lot of priorities, and this one, I don't think people understand the magnitude of the benefit that it can provide. But certainly, I think by starting small and showing results, I mean, nobody, throws a Hail Mary pass on the first down of a football game. So it's small steps that show improvement, and I think that's probably the best way to keep the ball rolling.
One of the things that I think a couple of years ago, as I look at our senior leadership team, we've always made approximately a $500,000 investment in our wellness program, which is not a small chunk of change. But a few years ago, we had the gall to go to Chuck and the senior leadership team and say, we really need you to walk the talk even more. And it wasn't just about the investment in wellness, but to really experience that so that we could get the trickle-down effect through the middle management team. And so the wellness manager here actually created a challenge for the senior leadership team and put pedometers on their hips and had them report their steps on a weekly basis. And the senior leadership challenged the administrative director level, which is the level right before them. And it wasn't a highly publicized thing, but it was something that got every senior and every administrative director to really understand that if you're only getting 3,000 steps in, you're pretty sedentary. And how difficult it was to have 7,000, 10,000 steps, especially when you're in a leadership position, you're in meetings all day, you're largely sedentary, and when you're as tall as Chuck is and you have long legs, he had his excuse for not getting his steps in. But I think one of the best ways is to get the senior leadership, and even if it's just a few of the seniors, to actually put a pedometer on and to do something like that, then they're going to actually feel what it's like and how challenging it may be for folks to eat healthy, to get their water intake, to sleep 8 hours a day. And that's essentially what we had them do. And then it's almost the light bulb goes off a little bit, and they say, you know what, this is really hard stuff, but it's important stuff to have the organization really pay attention to. And so when we did that, and they actually went through that experience, we started to see a lot more activity in terms of engagement at all levels of our organization.
That's great. We actually are getting several questions, so hopefully you could just try to keep them the answers a little more concise so I can squeeze them all in for you. But the first one is, what vendor do you use for your cafeteria and vending services?
They are all employees of Maine General. We do not vendor it out. It's our own food and nutrition department here, and they manage it. Okay, great.
What are you doing to ensure employee staffing is adequate to enable people to take breaks, minimize overtime, so they can consistently practice what you're preaching?
You know, part of the culture here has always been that when employees go to meet with their health coach, they do it on company time. They don't have to clock out to do that. And we've just built the culture that encourages physical activity, stress breaks, you know, whatever is necessary, because ultimately, if our employees are feeling well and their heads are clear and they're alert, they're going to provide better patient care to our patients and our community. And so we don't spend a lot of time tracking or managing that. It's part of the culture and it's part of how we do business.
Okay. Do you think these strategies translate to small employers who are not self-insured?
Absolutely. With the slide that I had with some of the companies up there, we have employers with fewer than 50 employees who have a comprehensive wellness program in place. They have a health coach that goes to their workplace. The smaller the employer, you know, the less frequency the health coach goes to the workplace. But the small employer I'm thinking of will tell you, you know, they were dabbling in wellness. They were trying to do some fun things. They knew it was important. But it wasn't until they actually contracted out with a consultant that really paved the way on, this is how you do it, this is how you do it well, brought a health coach in, and really got engagement where it needs to be. So I think absolutely, the bigger the employer, the more employees that are participating, the more health coaching hours that a company is going to need to really get the behavior change piece in place.
Okay, I think we have time for maybe just one or two more questions. Is there a number one prevailing influence that you find changes people's behavior, such as the culture of wellness, financial incentives, or sharing actual data with the employees? Was data the main impetus for Maine General to make changes?
You know, our rising healthcare costs really got the organization to do something and pay attention, and that came from our Human Resources Department way back when. At the employee level, I think, and the way we advise companies when they're just starting a wellness program, is that you offer an incentive to get them to the table, to get them to participate and to experience whatever it is that you're going to offer. And I think sometimes money talks, and sometimes to get things going, that financial incentive is important to get people to the table. But over time, it's less about that financial incentive, and it's really, we're focused on engagement and making it fun. And, you know, we're launching a challenge right now where the whole organization is creating teams and challenging each other on which team can get the most steps within the course of a period of time. And we're really trying to make it a fun activity that just helps all the way around. And so I think at this point we've gotten to the point that it's less about the financial piece of the financial incentive.
Okay, thank you, Denise. I'm going to just give you one final question here. Do you advise people to hire a consultant to help them with their wellness program development?
So I could be very biased in answering that and say absolutely. I do think that most businesses are not in the healthcare business. Most businesses, and even years ago when the senior leaders moved the wellness program from the Human Resources Department to my department at Workplace Health, we didn't know how to do wellness, and wellness means 100 different things to 100 different people. And it's really hard to sort through all of the information out there and try to establish what's right for your organization. So keeping that in mind, I think hiring a consultant that knows best practice, that's following the research and the data, that's saying this is what's working, I think has a lot of benefit. I also think that having a health coach coming into work in a face-to-face manner with employees in a personalized approach helps people to make those really difficult changes in lifestyle and behaviors and attain their goals, but it also helps hold them accountable, because I know when I have to meet with my health coach in 3 months and I set a personal goal for myself, and if I haven't been working on that, you know, that's not a good thing that I want to present to my health coach. So I think that accountability also helps with personal and overall success of the organization.
Thank you so much. This has been wonderful, very much appreciated, and I hope everybody else has enjoyed it as well. So thank you very much, Denise and Chuck, and that will conclude our webinar for today.